Extraction in children can be very challenging for a dentist. Children may not understand the need for extraction and may not cooperate during the procedure. And also, children experience fear and anxiety during the dental visits. Some children may cry, may move, or even bite during the procedure, and this adds challenges to the dentist. So, in order to overcome these challenges, you can use positive reinforcement and distraction techniques. Give anesthesia with minimal discomfort and use a kid-friendly technique while giving anesthesia. Also use the instruments as per the child's teeth anatomy, not the adult's teeth anatomy. Because you see, primary teeth are smaller as compared to the permanent teeth. Crowns of primary are more bulbous than that of the permanent teeth. And this is the reason beaks and handles of a primary extraction forceps are smaller. This is to accommodate the more bulbous crown, and also the beaks are more curved. Now, before you start with the deciduous tooth extraction, remember the tooth of primary teeth resorbs naturally. And don't forget to take consent form from the parents before you start any procedure in a child patient. Keep the instruments or the forceps behind the chair. Never show instruments to a child. And also never hold the needle in front of a child. Always keep the needle hidden by the fingers so that child is not scared of needle. Very important, apply tell, show, do technique. So tell is before you start any procedure, explain it to the child in simple and age appropriate language. Show the procedure. After explaining the procedure, demonstrate it either using props or models so that the child understand what will happen. And you can also use a tooth model or a puppet to demonstrate how extraction will be performed. So this visualization demonstrate helps the children understand what to expect, and also it reduces the fear of unknown. And finally, doing the procedure. So perform the procedure as discussed while continuously reassuring the child, and maintain a calm and gentle demeanor. Start slowly and gradually increase the intensity of the procedure when the child becomes comfortable. So you can use a positive reinforcement and praise throughout the process to encourage cooperation of a child. Before giving local anesthetic, apply a topical anesthesia first. And before you start the procedure, explain the sensation of pinching or ant biting to the child so that the child is not scared of injection. This video is a demonstration of pedo extraction forceps, how we are going to do the extraction in a child patient. So for the demonstration, we are using a budget-friendly pedo extraction kit of Waldent. I received the kit next day of placing the order and I bought it from Dental Cart, so fast delivery. It comes with 7 extraction forceps that are required for extraction in a child patient. You can easily distinguish upper and lower forceps, and upper forceps are straight. So you can see upper forceps, they are straight forceps, and the lower forceps, there is a bend in the lower forceps. So you can easily distinguish upper from the lower forceps. So this is upper anterior forceps. Apply the forceps beak to the most cervical area and then use clock and anti-clockwise rotation to extract upper anterior teeth with the help of this forceps. So you can see this is an upper anterior forceps. This one we have upper premolar forceps. So this is a little bit different from upper anterior, as space is bit more for premolar because of the size of the premolar. So it is used for upper premolar removal, and which is removed by the buccal expansion. So the next one is upper primary molar forceps. So this forceps can be identified as the arrow or a pointed beak. This is for engagement of a upper molar teeth. So expansion of the socket is required for a molar, and you can easily distinguish from the beak. You can identify it from a pointed beak or an arrow beak, because the upper primary molar have splayed root. So with the upper primary molar forceps, force is applied initially in the palatal to expand the socket, and then you continue with the buccal direction force. So you can actually easily identify a molar forceps and distinguish it from an anterior forceps. Now upper is a straight forceps and molar forceps is going to be a pointy forceps, which is a arrowhead shape beak you can see, and also this forceps is used for the molar extraction. So the last forceps in the upper section is a upper root forceps. This is also known as bayonet forceps. Now if you close the bayonet forceps, you can see the beak closes completely for this forceps, and that is how you can remove the roots, upper roots. Since it is a straight forceps, it is upper and the beak closes, so that is why it is a root forceps. So you can appreciate a bend in the forceps, so that is a lower forceps, and with the beaks you can see it is a lower anterior forceps. So it can be used for lower anterior teeth removal, and extraction for the lower anterior is same as that for the upper anterior teeth. Now lower anterior, lower premolars are removed by a rotatory motion around the long axis of the root. Bend in the root tells this is a lower forceps, and from the beak you can see again we have a pointed beak which engage the furcation area, so it is a lower primary molar forceps. So you can identify this forceps with the two pointed beaks that engage in the bifurcation, buccal and lingual bifurcation. So this is a lower primary molar forceps. Apply the forceps and move the teeth in buccal direction to expand the socket, to expand the buccal cortical plate. And with the beaks you can identify, with the pointed or the arrow beaks you can identify that this is a molar forceps. So the seventh and the last forceps from the kit, you can see the beaks closes completely for this forceps, and therefore we can identify that it is a lower root forceps. So it is used for removal of the lower root stumps if there is any root stump that is left inside, and as the beak closes you can identify that it is a lower root forceps. So these are the forceps, and always remember when you're doing extraction, use the correct forceps for doing extraction. So on each forceps the number is written, and from the box you can correlate which forceps is which one. So you can use these forceps, but always remember to use the correct extraction forceps for the extraction of a particular teeth. It is very challenging to do extraction in a child patient, so use the correct instrument. So that's about the demonstration of pedo extraction forceps, and if you find the video helpful, give it a thumbs up, comment in the comment section below, subscribe if you haven't done it yet, and a link is provided in the description if you're interested in buying this kit.